Hi, David here at Reform Physical Therapy and Pilates in downtown Cleveland. This week we are talking about central canal stenosis, particularly of the lumbar spine, the low back. So in patients that have this problem, I often see that they have a lack of hip extension. So what that means is that they have a decreased ability to bring their leg back behind them, typically because of stiffness. They get to this point, and then if they try to get more, they will try to maybe arch their back to get that, and that will cause pain into their legs and their back because of the stenosis problem. So oftentimes I will start by going after that hip extension, trying to gain more for them. So an easy stretch that my patients can do at home, especially if they're a little bit older, can be just a lying down off the bed hip extension stretch. So I have a little incline here. They can use pillows to build themselves up at home, but this helps to just decrease the challenge of it at first. Sometimes it's hard to be perfectly flat on the bed and let your hip fall off into extension. So this can be a little bit easier way to start. So how I do it, I just build up my area here for my trunk or for my chest to lay on, and I'm going to scoot to the edge of my bed. I'm going to keep my other leg bent and even maybe bring it up to my chest. And I'm going to take my free leg and just let it fall off of the bed. And I can just let gravity do its job and stretch the front part of my hip. And as long as I'm keeping this leg pulled into my chest, I can protect my low back from being arched and causing me pain if I have stenosis issues. Okay? I may only hold it for about 15 seconds, bring it back up, and then go again. If you want a little bit of extra stretch, you can even think about pushing your foot down towards the ground to get a little bit of active elongation of this front by using my hip extension muscles or my rear end muscles. So I might push down towards the ground and then release. Push down towards the ground and release. All that time I'm getting some elongation of the front of my hip. We can do that on both sides. That is something you can do every day, even twice a day if you have the time. So there you go. It is a hip extension stretch to improve your ability to tolerate stenosis. Thank you very much.